Greetings, Bellevue School District community. This is Ivan Duran, the superintendent of the Bellevue Schools. As we prepare to return more of our students to in-person learning in the weeks to come, we must make sure we are following proper mitigation strategies as outlined in our plans and the guidance from the Department of Health. For today's community conversation, we are joined by Sarah Riegel, Health Service Administrator, School-Based Partnerships, and Child Care for Seattle and King Counties. Sarah, thank you so much for joining us today. Please tell us about your role with King County Health and how your team has been assisting school districts since the pandemic began.
Thank you. It's nice to be here having this conversation with you today. Throughout the past year, Public Health in Seattle King County has been offering support to schools and families as they navigate opening classrooms during this pandemic. We started our task force more than a year ago in the latter part of February last year, putting together the opportunity to support schools, childcares that remained open, in implementing mitigation strategies, creating guidance where there was none at the time. Public health is just one part of this big puzzle. We can't answer all of the questions that families, students, and staff might have, but knowing what to expect may help families and school staff feel more confident about returning to in-person learning. So here's a little bit about what we've been doing sort of as pieces of this puzzle and how public health contributes to what you might expect when students are returning. We've been coordinating this task force that I mentioned, dedicated to supporting schools and childcare providers. It includes staff from both public health and from the Puget Sound Educational Service District. And we've been connecting regularly with school leaders like yourself in various meetings with educators, staff, parents, and the larger community to address the specific needs in this sector. The task force has developed tools and has provided training to schools and childcare providers on how to use those tools to help prevent and contain the spread of COVID-19. The King County Schools COVID Response Toolkit has also interpreted the Department of Health guidance and helps provide you with templates, tools, and ready-to-use resources to apply those recommendations in practice. In addition to the task force, we also have an outbreak and investigation and contact tracing team that's dedicated to working with schools. A strong partnership is in place to support schools and childcare providers that have had one or more positive COVID-19 cases. We're going to work closely with you and with all providers to identify those students or staff that may have been exposed, and our investigations team provides you with guidance and the tools needed to communicate quickly with impacted students and families so that COVID-19 is quickly and effectively contained.
That's great. Well, I think if we could just list out everything that's been new, over this last year, it'd probably be a pretty amazing list that we've had to put together, because I think here in public education, we're in the same situation where, we've never had to do this before, and we had to, really make some shifts pretty quickly. So really appreciate all that you've done. Your help to provide just clear direction and health guidance, it's been so important for us in communicating to school districts. And I know I've just been really appreciative all the times that you or Patty Hayes or anyone from your team has been able to join the superintendent's calls, and it's just been really beneficial for us. But especially in those early days of the pandemic, as we were all looking for guidance at the time, we weren't really quite sure exactly what it was supposed to look like. And just looking at how much has been accomplished over this last year has really been just phenomenal work. So again, just thank you and your team and Patty Hayes for all the work that you guys have done. But I think the one thing I continue to say this in conversations that I'm having is that we're not out of the pandemic yet, and I still have a lot of concerns right now with what we're seeing in our communities, where we're starting to see communication starting to go up again. We're starting to see more people emerging from their bubbles to venturing out in public, so it's starting to make me a little concerned. And, I wouldn't know, sure from the health perspective, you guys are watching that very closely also, but as many schools and childcare programs are preparing to bring more students back in person learning, what are some of the things our communities, should know and keep in mind at this time?
Yeah, well, as we prepare to do that, I'll look back at the last couple of weeks. Governor Inslee made a proclamation on the children and youth mental health crisis just a few weeks ago. And in that proclamation, he noted that since the physical closure of our schools, pediatricians have been seeing significant increase in youth with eating disorders, anxiety, mood disorders, and depression, those with suicidal thoughts or self-harm behaviors. We're really concerned that many families have experienced long wait times and limited access to mental health services for themselves and their children, and children are experiencing a significant sense of isolation and loss, all of which negatively impacts their learning, their grades, and sometimes their lifelong success. Increasing the option to return to school facilities for all K-12 students will help prevent or curtail the mental and behavioral health issues that we're seeing for many students by reducing isolation and improving in-person access to educators, school personnel, mentors, and peers, and all the services and supports that are available to them in the building. And while it's impossible to have zero risk of COVID-19 in classrooms, the research and our experience now is showing us that strong risk reduction strategies, multiple layers of mitigation work, can greatly limit the spread of COVID-19. And schools using such strategies can return to in-person learning with a lower level of risk, and then better able to meet the social and emotional and behavioral needs of students in addition to their academic supports. Every state in our school is required to follow the essential mitigation strategies for in-person learning. Those have been outlined by the Department of Health and reiterated by the governor in his proclamation.
Yeah, those are all just so important pieces to have in place. That's something we keep emphasizing. I remember from the very beginning, I think it was in the New York Times, they had like the Swiss cheese image of all the different mitigation strategies. We have to have them all in place.
Yeah, it's really important that all of them are done. It's a layered approach. And if we think of that Swiss cheese analogy, it's a perfect one that says, you know, we really need to do all of them to put those pieces together to make sure that the virus is not moving through our communities.
Absolutely. Yeah, and so that kind of even ties into just even, you know, with the many people getting the vaccine, that it's just another layer in place. In my last community conversation with Carrie Lang, our Director of Health Services and Special Education here at in the BSD, you know, she shared today that our district has worked with, you know, a few community partners and pharmacies to vaccinate over 850 educators at this time, including all of our staff. But yet we understand that vaccinations alone won't protect us from contracting COVID-19. Can you talk to us a little bit around specifically for those of us in classrooms and buildings, you know, what are some of those other just mitigation measures we just need to make sure we have in place in practice regularly, that we don't lose sight of what we need to keep doing?
Yeah, you're right. Well, it's a tremendous effort and great accomplishment to have more and more people in our community who are now vaccinated, including our school staff and educators. And we know, as you said, COVID-19 vaccination can help lower the risk to school staff in the buildings, in addition to, but it's not a replacement for, the effective implementation of those specific strategies. So I'll review again the main things that, the main ways of reducing exposure to coronavirus and to any other respiratory pathogen. In fact, our flu season has been really the lowest it's been in a long time this year because we're continuing to do this. And although these are mitigation strategies required by schools, there's still common sense for everyone in the community to keep these things in mind as we go about our days. Even if you're vaccinated, these are still the requirements and necessary for people in public. So first, it's an effort to keep ill people out of our school buildings. So we're educating students and families and staff to stay home when they're sick. I'm sure you've had more information about that. Using the screening methods like a daily or weekly regular attestation of symptoms. Any symptom screening or checking helps to provide for that. And if students are ill or potentially been exposed to someone who is ill, we have a really clear decision matrix about how long they need to stay home and what the protocols would be for that. The second is physical distancing, minimizing close contact with people, whether it's 3 feet or 6 feet, depending on the scenario you're in. In our school settings, we do want to maintain that distancing as much as possible. Hand hygiene, something that we've always worked on in schools for a long time, but we know that frequently washing with soap and water or using an alcohol-based hand gel is highly effective, and the opportunity to do so on a more frequent basis in our school systems will certainly help. Using our face coverings and requiring that for all students and staff. Staff have to follow the labor and industries and employer health and safety requirements for schools, and our mask guidance for the state still applies in school settings, wearing masks all the time. In addition to those that are probably more common and familiar to most of us in the community, schools are also asked to use cohorting where that's possible, which means keeping groups as small as possible, keeping activities in those groups that remain together over time with minimal mixing of groups. And that is more likely to be feasible at the elementary level and a bit more challenging and not necessarily expected at the middle and high school level in our new guidance. We also increased our environmental cleaning and disinfection. We prioritize the cleaning of high-touch surfaces in buildings. You could probably share a little bit more about how you're doing that in your buildings. Improving indoor ventilation by opening our windows or improving our HVAC systems. And then also utilizing other low-risk spaces like outdoors. We know that being outdoors is safer than being indoors. So where possible, you may have chosen to move certain activities outside. So these are really the key things that we know are effective in reducing the spread of COVID-19. And as I said, as you mentioned, cases are increasing in our community and they're still out there. Our schools are not going to be islands or isolated locations where just because we do these things, there will be no cases. But what we have shown is that when there is a case or even 2 cases, we can reduce the spread, which is really the most important thing.
Yeah, I agree with that. And I think to your point around, thankfully, the sun coming out a little bit more now, maybe we can start to utilize outdoor spaces in different ways, so appreciate that. And I know here in Bellevue, our teams have just done a pretty amazing job, make sure that we're, have all these in place. And even, throughout the day when I'm in my office or visiting schools, I see our staff walking around, wiping, doors down, doing those things. And I think it's just going to continue as to do that, just really encourage everybody just to be really mindful of that and just to keep, taking this, very seriously, because we don't want any kind of spread in our schools. We don't want cases, but we know we will. But we just want to make sure everybody's just doing everything they can. So another question for you, and just kind of shift a little bit to families, because, we've asked our families, both at elementary and secondary level, if they want to stay in, hybrid, which means they would get in-person services, or if they want to switch to virtual or vice versa. We've had, quite a few families who have chosen to go into virtual, and not to come to any in-person. And then we have some families that, really just still aren't sure, so as we think about, information, for our families, that may still have a lot of questions about, returning to school this year in person, just what information you provide to them and anything that you can do to help them in the decisions that they have to make.
Well, it's really important to note that, remote is still an option for every student who chooses and every family who wants to do that. So that's really important. I know that was important to the governor as well in his request to have schools return to more in-person learning. So every family needs to make some decisions about the risks that they're willing to take and whether they have other high-risk adults who may not be vaccinated at home, and what their individual circumstances are. But we also know, as I mentioned, the mental health effects of being at home, the ability to learn remotely for some students just is not the best method, is not working. And we want to provide an in-person option so that is available to students who prefer to come to school and who need to do so for supports and services. So it's still important for us to continue to implement all of those mitigation strategies and to think about the opportunity to return our students to a little more normal socialization for their social emotional development as well.
That's great. And then here in Bellevue, we've had, some of our students back, since the beginning of the year. We even had some students, obviously since March, who were getting childcare and other kind of services. So as we now have, our K through 2 students back, we have more of our 3rd through 5th grade students back, and we just reached agreement with our association for our secondary students. So kind of along the same lines with the families, as we prepare for returning more students in, what are some of the key things our educators need to keep in mind over this springtime? And then we'll talk a little bit about the fall afterwards.
Yeah, well, things are rapidly changing, as you noted. In this last year, we all learned along the way. Research became more apparent and clear, and we got a better understanding of sort of what works. And what we didn't know last March when we closed schools was really about the impact of those mitigation strategies and the effectiveness that they can have in our school buildings. And I think, though, vaccines are really exciting right now. It is, unlikely that vaccines will be widely available for children in the near future. So we're still thinking about our entire population. So it's clear and it's highly likely that we're going to have to keep utilizing these mitigation strategies into the future, likely through next fall. So this is sort of our new normal of school for the time being, to really, agree to implement these strategies, to work hard on doing so. And to keep those sort of top in mind, that this is something we want for our kids for the spring, will likely be something that we engage with in the fall, as you're all doing fall planning as well.
Yeah, that's going to be some of our next work, especially now with the change from the 6 foot to the 3 foot. That's going to help us in our planning, our efforts to try to do the best things for our learning environments as we move forward. So as we kind of wrap this up, any final thoughts from you? Anything that you would like to share, just from a general perspective, or you'd like to add?
Just that, our team at Public Health here wants to continue to support districts as they plan to return students to in-person learning over the next few weeks. Once you have more students in your buildings, your needs may change, and we're here, our task force and our case investigators and Our teams will continue to be available to address questions from the community, from yourself and from staff, as well as students and families, and continues to support the ongoing implementation of those strategies in your buildings.
Great. Well, great. Well, thank you so much for sharing, all this information and, and just all your work to keep us informed, safe and healthy. Like I said in the beginning, we have all just had to make tremendous changes over the last year. We've learned a lot, and I really think we're in a better place now. We'll be in a better place for the future. And so I'm just really grateful, for all the support you provided to our learning communities, not just here in Bellevue, but across King County. Again, just the times we've been able to get on conversations with you and Patty and the rest of your team, we've learned so much, and I feel you guys have just taken things and come back with other ideas, and just really appreciative. So thank you for your time today. Thank you for making some ways just to share more information. Again, just appreciate all that you've been doing.
Thanks to you as well. Thanks. I appreciate all of the work that you and your staff and students and families are all doing to protect themselves and to prioritize the health and safety of your students, in addition to their academic and social emotional needs.
Well, I want to thank everyone that was able to watch this community conversation. We are working on our next conversation, which will include one of our students has been doing some fascinating research, interviewing students across the district and the impact that this pandemic has had on them. So really looking forward to that next conversation. So stay tuned, and thank you all for joining us, and we will see you next time.